Welcome back to the Awesome Physio YouTube channel. Today's video we are talking about why am I getting pain around the side of my hip. So we're going to dive into the most common musculoskeletal conditions that can impact or trigger pain into the side of the hip. Lots of people come into clinic and report hip pain or myalgia or muscle ache or soreness around this area, so we're going to break down the most common conditions that can trigger pain there. So the first condition we're going to be talking about is greater trochenteric pain syndrome, or previously known as trochenteric bursitis. So this is a clinical diagnosis that encompasses pain around the side of the hip, looking at gluteus medius and minimus tendinopathy, inflammation of the surrounding bursa in the side of the hip, as well as actually damage to the muscle bellies of the gluteus medius and minimus. So all of these things coming together can represent pain around the side of the hip. So previous research thought that the main pain symptom or the main trigger of the pain was the trochenteric bursa, the bursa around the side, but what actually more research has found, or more recent research has found, it's the gluteus medius and minimus tendinopathies that are triggering pain around the side of the hip. So when we're looking at diagnosis and focus, that is one of the key areas that we want to address first. Most people coming into clinic will present with localized dull ache around the side of the hip, possibly a little bit sharp on certain movements over that greater trochanter, over the side of the hip. What they normally present with, or what they normally say, is from seated to standing, going up and down stairs, or using it with physical activity, or even lying onto that side can trigger the pain and soreness to manifest. So it can be really debilitating day to day for many people suffering with this condition. So what might trigger this pain to come on? And there's lots of different reasons for this. One of the most common things, like we said, is obviously damage to those tendons, the gluteus minimus and medius, which are key muscles to stabilize the pelvis, as well as abducting the hip, so taking the hip out to the side. So anytime we're doing an activity repetitively that is bringing the leg out to the side, or we're needing to stabilize through the hips, if we're suddenly changing the frequency, the intensity or the duration of that activity, putting more pressure into the side of the hips, that might trigger damage into that tendon, so degeneration and inflammation of that tendon, meaning over time pain builds up and then the bursa inflames and it's that horrible chain reaction of everything getting sore. It could potentially be direct trauma into that side, although really unlikely. Normally it's that overuse injury over time, or could potentially be linked with osteoarthritis of the hip that we're going to dive into a little bit later. So wear and tear might trigger pain or issues in the tendons based on the fact if the hip joint's not moving properly, the tendons are having to work harder to stabilize and help with that movement, which could potentially lead to weakness and soreness in those muscle bellies. So lots of things can come together. So what we would look at in clinic is assessing your hip movement, assessing and looking at power of those gluteus minimus and medius muscles, looking at the other surrounding muscles to see if they might be impacting the pain, and then working out, do we need to allow the tendon to heal first, so that kind of acute management. Is it that we need to take some of that bursa inflammation down with ice, or is it that we need to regain movement and stability to help protect that hip joint and help reduce that soreness? Second condition that we're going to be talking about is iliotibial band syndrome. So this is where individuals can present into the clinic with pain around the side of the hip, but also more importantly with this condition, pain around the outer lower side of the knee near that tibia. So it's one of the most common conditions among runners. The reason why ITB syndrome can actually cause pain into the knee as well as the hip is you've got deep fibrous connective tissue linking with the tensor fascia lata and the gluteus maximus, blending down into that iliotibial band all the way down to the bottom of the knee. So if you're suddenly changing either how you're running, so going back to that change in frequency, intensity or duration, suddenly through that leg can cause that to inflame and become sore. It might be overuse injury if we're not stretching down into that area, or it could be that we've got a weakness around those pelvic stabilizing muscles, so the glute muscles, external rotators of the hip, all of that area, which means that we put more pressure around the front of the leg, loading more into that ITB when we run. So lots of different things going on. So what we would look at if someone's coming into clinic and what they might present with, like I said, is localized pain in the hip as well as the knee. They might have limited movement through both joints. It would be worse as they're starting to do that activity. So when they're initiating either the running or the walking, they might be struggling to weight bear on that side. So it's quite obvious that there's severe pain or soreness in that area. And like I said, it tends to build up over time the more that they're using it if it's not being allowed to heal. What we need to look at is stretching and relaxing around that area. More importantly, strengthening higher if need be, you know, if it's putting pressure through there, through the glute muscles, going for a strengthening routine, and then very gradually building up that activity again over time to help ensure that it's healed, but also that it's less likely to occur again. The last thing that we want to talk about is referral into the side of the hip. And what's really interesting when someone comes into clinic is there's lots of different structures that can give a pattern of pain, but can also refer into the side of the hip. So number one, if we're thinking about femoral acetabular impingement or labral issues in the hip, so we've got damage to the internal structures of the hip joint, either through trauma or repetitive degeneration, meaning that the normal articular movement of the hip is being impacted. What typically happens is someone can present with stiffness, limited motion and pain on weight bearing in the hip, but what can also happen due to the innervations to the nerve supply to the labrum inside the hip is you can get something called a C sign, which is a sign around the side of the hip. So again, it muddies the pattern of what's going on, but what we would want to look at in that particular case is someone's past history, any history of dysplasia, any issues of movement through the hip that could be referring into the side, triggering that pain. So again, a little bit more complex. Second thing that we'd be wanting to think about is any trigger point referral. So if there's tightness into the back or into the muscles of the pelvis, could that also be referring pain into the side of the hip? So sometimes when we palpate around and we palpate into the back and the glutes and see how that feels as someone's moving, sometimes we'll push on one point and that will reproduce the pain into the side of the hip. So that could be from the piriformis muscle, blending from the sacrum to the side of the hip. It could be the big glute max muscle, it could be the lumbar rectus spine or the QL, where when we're pushing down, that can trigger pain round to the side. So we would want to know how it came on, what might be the aggravating factors, can we stretch and release through that area to help with the pain, and then general mobility through that area so someone's moving properly after. Like with all of the stuff we've spoken about today, it's always worth getting it assessed by a musculoskeletal expert. They'll be able to tell you if you need a treatment or assessment, what the best next steps are to get you out of pain and get you back on your feet.